Yes.
Okay. I think we'll start. There's just a couple more people to come in. Welcome back, everyone. This afternoon, our presenter is Huang. He graduated from Nanjing University of TCM in China. Jian has been practicing TCM acupuncture and involved in research for over 30 years. He is also an expert in mini-Ren acupuncture therapy. Jian's presentation today is on clinical application of mini-Ren acupuncture therapy. So without further delay, I'll pass the mic over to Jian to start.
Okay, thank you, Josie, and nice to see you guys again. And I'm very happy, that I took a chance to introduce my mini Zen acupuncture therapy today within our MPAA association, because I'm the co-founder of this association, and I saw lots of new members join us, so I'm very happy for that. And yeah, so that today I'm very glad to have a chance to introduce my mini Zen acupuncture therapy. Actually, we did also have a plan 2 years ago before the pandemic, that the time that we want to have a training course, that in our association for our members, but because pandemic, so everything is screwed up. So right now that we are getting back slowly, and I hope that today that you guys can get more information about mini Zen acupuncture. And of course, if you guys have any questions, you can ask me. And also that if you have any interesting to learn this kind of therapy, also let me know too. Okay, thank you. And first of all, that I would like maybe take this chance to have that announcement, to hire a person that in my clinic. If any person that have time during the weekend, I want to work in the part-time job. So we are looking for the person, a licensed acupuncture therapist to work in my clinic during the weekend. Okay. So if any persons that have time to do that, please contact me. You can send email to me, or that contact me by WeChat. Thank you. Before the real presentation, I just want to have small video introduce my clinic and also the mini Zen acupuncture. This video made by my patient, that he's very interested in my techniques and make the video for me. I just planned for you guys.
In my clinic, of course, I do regular acupuncture needles too, and also that I use my kind of specific acupuncture needle we call mini Zen acupuncture needle. This needle is different from regular needle because it has very tiny blade on the top of the needle, just like life. Our clinic, most of patients, because of the pain and looking for our help. The cause of the pain, it has lots of the reasons. The pain caused by scar adhesion tissues and also trigger points. It is kind of the nodule that lots of people tell me, doctor, see that I'm pain exactly on this place, but when you pap it, you can find it has a nodule underneath of the skin or in the muscle or in the tendons or ligament. So in this kind of conditions, regular acupuncture needles may achieve a temporary short-term the result, because the nodules increase the tension in the local areas, which cause secondary and consequent injuries, repeated injuries. That's why it causes chronic pain. With this kind of mini Zen acupuncture needles, right now I'm using every day for those kind of pain patients. I feel it works much better than traditional acupuncture needles, because with these needles, we can use the blade directly to break up those kind of scar adhesion tissues and also the trigger points, which can cause chronic pain conditions. With my treatment, sometimes maybe just a few seconds, sometimes few minutes, the patients feel pain getting better right away.
Much easier, right?
Oh yeah.
Yeah, much easier.
That last part was from what they're on.
Yeah.
It was very painful.
Yes.
That's no pain.
No
at all. Nothing.
So with these techniques, that it can achieve that quick long-term result too. So that's why I use a mini Zen acupuncture needle.
Okay, so that this is kind of brief introduction of my medicine acupuncture, and also that you see that introduced my background a little bit. So I just want to take the chance, to introduce my educational background and even more. So that basically that I graduated from the Nanjing Traditional Chinese Medicine College from 1988, that time, and also I got my master degrees during 1998 and 1991. And then that from 1994 to 1997, that I achieved that medicine doctor's degree in Peking Union Medical College and the Chinese Academy of Medical Sciences. That this college is kind of tops, that the medical school in China. And also after graduate and I got my doctor degrees, I worked as a research assistant, during 1997 and 1998. In China-Japan Friendship, Clinical Research Institute in Beijing. And from 1998 to 2005, I was at the postdoctoral fellow in University of Manitoba in Canada. And after that, from 2005 to present, I'm working in my clinic. We call Huang Acupuncture Healing Center, Winnipeg, Canada. Okay. And also that I'd like to introduce my two books just published last year. That one that is the collection of the single Chinese herb clinic applications, and this is this one. And also that I have another book. It is for the collection of single acupuncture points clinic application. So they are very useful, for our practice in my clinic. In our clinic, if you are using Chinese herb medicines or acupuncture treatment. So this book is supposed to be very, very good, conference book, that to learn to study and to improve that the technologies and the experiences. Now here that I have another video that I want to introduce that because this is my friend and also my patient, John. He has been my patient over 20 years. In the first, that 5-6 years, that time he was my patient, frequently visit me, and then that in the last 5 years and 2 years, also he come back more frequently because he is that physical active person. He likes to play hockey, golf, and all kinds of sports. And of course, he has lots of injuries, from sports injuries. And before the treatment works very well, but after that, with the aging process and more active, and active injuries, and he got more and more scar tissues that actually that with my traditional acupuncture treatment, it doesn't work very well. So since I used my mini Zen acupuncture for him, he was much happier than before. So that's why he gave me one kind of testimonials, that I want to play for you guys.
All right. Hi, my name is John. I'm a 67-year-old male patient of Dr. Gojin, and I've been coming to see him for a while for a number of various ailments, but recently I've had lots of difficulty with my left knee. My left knee was generally my good knee. My right knee is more of an issue, but I do have osteoarthritis, and both knees are typical for somebody who's been about to be paneled for a knee replacement. Anyways, coming to see Gojin, I was experiencing great pain in my knee, great pain in my IT band, and after honestly walking in, I was walking like a man who was much, much older than I am, and it was shocking to me and quite depressing as well. And after 3 treatments, I couldn't believe it. The difference is incredible. I'm walking still with pain in my knees because of the arthritis, but I'm walking like I used to walk 10 years ago, and I feel like I have a spring in my step, and looking forward to getting out and being even more active than I've been. Hockey season's coming up. I'm working on the end of the golf season, and it just feels so much better. I would encourage anybody who's got this type of pain, knee pain, ITB band, sports injuries, come and see Gojin, and I think you'll find the difference will be incredible.
Okay, so that is the kind of the mini Zen acupuncture that from John's that experiences. He was very happy every time after he come here for treatment and getting better right away. So actually, this technique is come from the one kind of the therapy we call acupuncture. So acupuncture is it's kind of terminal word. I mean, lots of people maybe don't understand it is. It is kind of we call the small live needle. It means that the needles with the blade, that works has double functions. One as live, when to cutting, when it's at the acupuncture needles to stimulate the points. So that's we call that acupuncture. So Dr. Han Zhu, who invented this acupuncture in the 1970s. Okay, so this is the kind of background of that acupuncture that involves both an acupuncture needle and the surgical, that the scalpel. Was developed in 1976 by Professor Han Zhu of China. As a modern acupuncture treatment, it has been used to treat patients with pain caused by various diseases and can be used to remove chronic lesions in soft tissue. To date, sufferers cured by acupuncture total 100 million in China. And every year, 300,000 undergo needle knife therapy, we call acupuncture, every day. In 2000, Professor Zhu was accepted as a member of the American Academy of Experts in Traumatic Stress. And in 2001, in order to honor the contribution done by Professor Zhu, International Star Registry named a star of the Canis Minor, this number as a Zhuhan Zhang star. So he achieved the very high honor, that because he invented this kind of acupuncture. But unfortunately, he was passed away that almost 10 years ago. This is his kind of statues, that after he died, and and people made the statue for him to memorize him. And here's that the picture there. And he also published lots of books and also that research articles, in the past 2 decades. So enlightenment of acupuncture in China, what it is, because that people always ask that, hey, in China, we do have that the acupuncture has been 1,000 years. Why that acupuncture become popular in China? Because the acupuncture doesn't work? Yes, acupuncture still works. But for some cases, acupuncture, traditional acupuncture doesn't work very well. That's why we need some new techniques, to improve our experience, our success. That's why that acupuncture right now it is very popular in China. So advantages of small needle, live therapy is simple, less painful, and quick to take effect, changing pain disease treatment from incurable to curable, from complex to simple, from intractable to rapid healing. So it is very popular among the patients. So that's the reasons why that the acupuncture right now, it is very popular, because it can help doctors to resolve lots of problems which could not be resolved by traditional acupuncture or by Western medicines. Otherwise, you have to get maybe big surgeries for some issues. But with this therapy, we don't need any surgeries. We can achieve the very good result. Here, another video that is my patient. Actually, that her background, her medical history was that 2 years ago, he was injured from her knee, and then that was very bad. Actually, doctors, think that he need to get a knee replacement surgery. When she was, in my clinic, her pain was very, very bad. That her whole areas on her that the left side, was very painful. Even she couldn't walk very well. So after the 2-session treatment, he feels so good. and he was so excited, to make this kind of video for me.
Hi, my name is Sharon and I am from Winnipeg. I fell at work 3 years ago on my knee. I was unable to walk around. I was constantly having knee pain, knee swelling. My knee was constantly knocking out on me where I was unsure of taking my next step forward. I sought out medical treatment. I was doing physio twice a week for basically almost a year. Been followed by orthopedics. I was then referred to orthopedic surgeon, and they suggested to have knee surgery, and that was going to be involving anchors and about 6 weeks of bed rest. Could not do that, so I knew I had to seek out other treatment. I began to do my research on acupuncture, and I came across Dr. Huang, and I decided I have nothing to lose at this point and everything to gain. Day one when I seen him, I was unable to walk. I can't do any kind of bending, no twisting, so I've been taken off of work. I've been off work 14 months. After my third treatment, I no longer had the pain. My knee was no longer knocking out on me, and I could feel I could take one step forward without any concern whether or not my knee was going to give out on me. Acupuncture has been my lifesaver. Thank you very much.
Yeah, so actually that after that the treatment right now, she's almost not come here anymore, because he told me that her pain is completely gone. Right now he back to work, and also he referred her that the co-workers, her family members come to see me too. So right now that actually my appointment every day is very, very busy because lots of new patients coming every day. So anyway, so that's why that from the acupotomy or mini Zen acupuncture, that the advantages that we can treat those kind of very complex, incurable, that the pain conditions become the curable, and that achieve the very good result. And a lot of people that maybe don't understand why that your needles can, break up the scar tissues, because we all know that when our body get injured, we all, our body as the healing process always make the scar tissues as consequences of the healing process, right? But of course, most of the time, the scar tissue, helps us, that to heal the injuries. But of course, it also can cause lots of troubles, that to compress the nerves and blood vessels, and that when the adhesive tissues, formed, it can cause secondary tearing of the soft tissues around, damaged areas. So here that the small videos to introduce how that the using acupuncture needle to break up the scar tissues.
Today, I would like to present how to use our mini zinc acupuncture needle to break up scar tissue. These two file gun represent normal muscles. These wraps represent the skin and normal soft tissues. In normal physiological conditions, they should move very smoothly up and down, back and forth. But in case the muscle got injured and then scar tissue formed, this muscle movement will be interrupted. For example, we have a string here, just represent the scar tissues between, because there are no any elastic fibers between, so it's hard to move them. And then how to break up the scar tissues, because in our acupuncture clinic, most of the time we only use this regular acupuncture needles. Of course, we can try to break up, but most of the time we can go through, but it can't to break up. But if you use mini zinc acupuncture needle, and then it is very easy to break up, because it has a very sharp blade on top of the needles. We can directly to cut it. Yeah, and then the scar tissue will break up directly, and then the muscle movement will back to normal. So that's the differences from mini zinc acupuncture needle and the regular acupuncture needle for scar tissues.
Okay, so that I hope that you guys understand, why I'm using that, because it works very good and also very unique, to resolve the scar tissue caused the pain. So that is very, very good, that the weapon, we treat those kind of pain. So that's why I say the blood leader is the best, solution to break up my fascial trigger points too. We all know that my fascial trigger points is a pain for the or tender the nodules. It can increase the tension inside the nodule and outside of tissues. It has tons of pain chemical substances stimulating nerve ending to cause the tenderness and the pain. It has poor micro circulation side of the nodule, which cause that tissue necrosis. Meaning acupuncture needle, blood needle is more effective to release abnormal tension of my fascial trigger point nodule and wash out the chemical pain substances from the pain areas. And also meaning the blood needle can improve microcirculation around my fascial trigger points to promote the healing process. And also meaning acupuncture blood needle can directly cut off the collective tissues of scar and the trigger points, which compress the surrounding soft tissues, blood vessels, and nerve fibers, very effectively release the pain, tenderness and tingles, numbness. So MRI needle that stimulating action can help loosen up, muscle cramps, release some muscle stiffness and pain. So that's why that I say this kind of mini zinc needles has double functions, double benefits. One is that as a blade, it can cut off, break up those kind of collective tissues. Second, the benefit is that from needle itself to stimulate those kind of acupuncture points. So that's why it has a double, advantages than regular acupuncture needles. Here that maybe people ask, hey, why that we can't perform the regular acupotomy in Canada? Because since that acupotomy invented in China in 1970s, actually right now the more and more that this kind of treatment has been performed in the Chinese hospitals, not in the clinic. The reasons, because first of all, it needs that anesthetic drugs to freeze the pain, because the regular acupuncture needles is bigger and longer and more painful. So that's why it needs some kind of drugs to freeze the pain. And also it needs that in graphic equipment to help accurate diagnosis and treatment, but we don't have those kind of equipment in our acupuncture clinic. And also it needs special operating room, that it looks like that surgery operation. And also it needs medical team support, that because after treatment, the nurse, that the nurse assistant, take care of the patient, to prevent any kind of side effect. And also that it has more bleeding during the treatment because it has big needles. That's why it always can cause that the massive bleedings during the treatment. It has more risk to injure that blood vessels, nerves, and the body supportive systems, because the techniques it always go to very deep, go to the deep of the bone. That's why. And also it may cause secondary scar and adhesion because it has big the needles, and then it can cause secondary the scar tissues. And the needle could insert very deep on the bone surface to perform treatment. So that's of course some risk. The technique is complex, not just needs up and down insertion, but also needs appearing in different directions. So if our knowledge or anatomy knowledge is not very rich, and it probably that maybe cause more damage to the surrounding the nerves, blood vessels. So that's why. And it needs very solid anatomy knowledge and experiences. So that's why that I say we can't perform the regular acupuncture in Canada or States or any other countries, because we don't have those kind of equipment and and support teams. And minizine acupuncture is the best choice. Why? Because we talk about acupotomy, but from minizine acupuncture, first of all, it is very safe. It works, very superficial. We never go too deep to the bone. Second one is it has very mild pain or almost no pain, so patient feels, kind of comfortable. But I don't want to say no pain at all. Okay, but of course, still very effective. Very effective, and almost no side effects at all. And also no need unique equipment and drugs, to freeze the treatment areas. So that's why we can perform in our regular acupuncture needle. And no need special treatment room. Simple and easy operate. So this techniques just up and down insertion, and then to break up those kind of fibers. That's it. And treat deep nail pain in the superficial nail, skin, and fascia. So even the pain very deep in our body, but we still can find a way in very superficial the layers, to help to treat this kind of pain. So that's why minizine acupuncture is the best choices in our clinic. Okay, so maybe you are asking now, hey, what's the minizine acupuncture? So I really want to know what it is, right? So minizine acupuncture therapy is developed based on traditional tiny knife needle acupotomy to target superficial facial nodules, muscle spasms, and scar tissue adhesion. Okay, it is a very effective, revolutionary, minimum invasive therapy to treat various soft tissue injury pains, nerve compression, dysfunction, etc. So that's the best definition. The features and advantages of minizine therapy. It has few features. First of all, the needle tip blade edge is very tiny, only 3.5 to 0.5 millimeter. So the pain is mild and tolerable by most patients without any drugs or the substances. The therapy is very safe, same as regular acupuncture needles, which it may cause very little bleeding or no bleeding at all to avoid secondary damage. The third, the treatment process is easy and pleasant. Each session of treatment lasts only around 2 to 10 minutes. Treatment frequency is once every 3 days. The general course of treatment can be 1 to 3 times, and 30 to 50 patients can be seen by 1 day. So if you have the limited, that treatment room that in your clinic, if you use this kind of techniques, that maybe just 1 treatment room, that's enough for you to take 30 to 40 patients a day. So that is very, very good, that advantages, for our limited, space in the clinic. And the treatment process is very safe. The insertion depth is typically less than 1 centimeter and will not damage big nerves or important blood vessels in deep layers. And the treatment method is simple with only up and down insertion without longitudinal or lateral peeling or other manipulation technique. It does not need other combined therapy such as massage, cupping, etc. Of course, you can use that as a major treatment technique, and also you can use as just assistant techniques that combine with the acupuncture, massage, and cupping, manipulation, anything combine or just do it by itself is good enough too. And this therapy supplies accurate treatment by finding the injured muscle fascia based on the patient's movement disturbances. So all patients come here, we have to analyze what happened to the patient, what muscle has been injured, and then we can perform accurate diagnosis and accurate treatment. The treatment target is tissue include deep and the shallow, the fascia, the tendons, superficial muscle attachment sites, muscle spasm trigger points, cutaneous nerve compression sites, etc. Okay. The curative effect is immediate, such as neck pain, dizziness caused by cervical spondylosis, and lower extremity numbness, lower back pain caused by lumbar disc herniations. The long-term effects are even better because this treatment is exacted to remove the cause of the pain. Diagnosis and treatment are objective and reproducible. The treatment effect can be confirmed by whether the pain for nodule are eliminated or not based on fingertips palpitating. So that's why that the treatment is very objective. Everything under your fingertips can tell you this patient, where the pain, how's their treatment, if the treatment works or doesn't work, even that you don't have to ask a patient, you can tell by yourself from your fingertips. So that's why the theory basis is a simple, objective, and scientific. It is easy to learn and to practice. So that's why I'm happy to have chance to introduce this to our association members. Minizing acupuncture clinic applications. Lots of people ask me, hey, how's it, to use that, and how many patients can, or how different kind of diseases can be treated by this kind of techniques. Okay. First of all, we talk about that acupotomy from the Professor Hanzhang Zhu invented in 1970s as a unique micro-invasive technology in China. It has achieved great success in treatment of soft tissue injury disease, internal medical disease, surgical disease, gynecological disease, orthopedics, and ENT disease. According to incomplete statistics, there are more than 300 indications for acupotomy medicines. So more than 300 different kinds of issues can be used, and accessed by this technique. Here that list all kind of different kind of diseases, even include that kind of arthritis, spinal stenosis, the various cervical, thoracic or lumbar spine surgery complications, intractable head and neck pain, shoulder pain, blah blah blah. So of course, for the pain, it works super. And also it can work on the surgery part, like cystic, hyperplasia of the breast, another fissures, kidney stones, etc. Also, we use in the internal medicine part for chronic bronchitis, asthma, gastritis, gastric ulcer, diabetes too, and also that for women, for ENT, and also actually that not right now in China, even that in States, I know in Canada, some acupuncture therapists use this kind of techniques for the plastic surgery, for cosmetic, the treatment, and also have to lose weight. This is, that application from the acupotomy, but from my own with the minizing acupuncture in the last 10 years, I just feel that I have deeply realized that minizing acupuncture is a miracle therapy that, fascinated me. It has that magic effect to many diseases. And meanwhile, the advantages of this therapy are time efficiency, amazing immediate result, and better long-term recovery. According to my incomplete statistics, there are dozens of diseases that have been using minizing acupuncture treatment, including that various, soft tissue injury, pain syndromes, dizziness, headache, cervical spondylinosis, various nerve compression disorders, anxiety, pain disease, Parkinson's disease, ENT disease, eye disease, allergic disease, digestive disease, stroke, and hemifacial spasm, trigeminal neuralgia, asthma, COPD, breast pain, etc. So right now, I almost treat every day, maybe 20 to 30 patients a day with minizing acupuncture, and I'm, that very confident. I say I always achieve the guaranteed result. I mean, very good result. All patients coming after treatment, whatever from 50%, 70%, 80%. There will feel different right away. So, and most of them, they will come back. So here are the two, maybe that small videos, just show how do I treat, some patient. Here that the first one, that the minizing treatment for just 1 minute to cure the bicep pain. This lady has been injured her biceps for a few months, has been treated by physio, chiropractor, and the massage therapist, and then that didn't work at all. Come to my clinic, and just 1 minute, her pain is gone. Let me take a look.
So it doesn't hurt right now.
Doesn't hurt, eh? Okay.
Okay, that hurts.
Yeah, that's hurt, right?
Yes, yes.
Yes. But your elbow pain that the wing is this way, how long has it been?
Oh yeah, that's the word.
3 months?
Like right there, at least 3 months,
Within
yeah.
3 months, okay, so here pain here, okay. It's tender there,
Yeah,
see? That the pec minor also has issues too, that's why some
Yeah.
people have chest pain, okay? And then you have biceps pain, yeah. Okay. Okay, good. Oh yeah, a little bit right?
not too bad.
Not too bad, eh? Because of the here, some people have some pain here too. Okay, good. So yeah, just relax here. Okay, so I want to work on the card. Okay, do it. Oh, how's candy? It's good. No, I'm serious. Ask you.
Yeah, it's okay.
Okay.
Here, because some patients are not scared of the pain, so usually I prepare some candy for patients. That yeah, when patients sitting there for treatment, also that I want to prevent that the faintings during the treatment because nerveless of the treatment. So basically, it works very well. All patients like my candy.
So it's
So
no pain again. Sometimes have to take a little bit. 看这次还挺好，应该到这买还比较便宜，10几块钱一盒。
And there's a lot of pain?
No, just a little bit. Little bit.
So this video is original. I didn't edit it at all. So that's all the treatment process. Just show you guys. That you may understand. How do I treat? That to check my patient and then to get the treatment, and then we'll see the result.
You alright?
Mm-hmm.
Yeah. Good.
So after treatment, usually I use fingers to double check that the treatment, that the nodules, if it's getting smaller, getting flatter, or disappeared, to double check. And also after that, use fingertips, just press a little bit to prevent any bleeding could happen from the treatment areas.
Oh yeah.
It's not bad.
Oh yeah.
Yeah.
This is the bicep insertion part on the radial side.
So then wait. Yeah, right.
Mm-hmm.
So actually that all the tendon is from the patient, from the fingertips you can tell, and then you can confirm from the patient, after you compress it, the patient say, oh yes, it's very painful because and their fingertips is already there.
Do it.
Yeah, that hurts still.
Yeah. Which part hurt?
Like right in here.
Right here now, right?
Just, yeah.
Do it. Yeah. Try harder.
Yeah, that hurts.
Okay.
In the middle, like right there, yeah.
Here, right?
Like so when I'm trying to pull up like this,
Yes.
that's where the pain happens.
Yes. Yeah, right. Good in here.
So for this kind of treatment, sometimes we need, more patient to take care, to looking for those kind of the nodules which cause the pain. So we need, that pay a little bit more time, to do that. But after that, we can achieve the miracle result right away.
That's not too bad. That would hurt like when I bend my elbow.
Yes, that's why that I want to check
Yeah.
up to see. try starting to bend your elbows again slowly. When you feel pain, just stop there.
Pardon me?
Just try to bend, slowly bend. When pain happens, just stop there. Where's pain?
No pain.
No pain. Are you kidding me?
No, no pain.
Try again.
Yeah, no pain.
Yeah?
Okay, that's absolutely crazy.
No pain.
No pain.
Okay. So where's your pain?
There's no pain.
Okay, we're done today.
Really?
Yeah? Your pain's gone.
Yeah, there's no pain.
I should be happy for that, right?
Yeah, so that's the patient's after treatment. He was so happy. And then that before I planned to give her 5 sessions, but only 1 session. And then she canceled all other appointments because he said, "No, my pain is gone. I don't need any more treatment." So that's why that I want to show that, this video to you. And these ladies also have a knee pain, knee joints pain. So that also just, take 1 minute for treatment. The pain, we'll see what happened.
Ready to go? Okay. So where's pain today that you have? Knee pain? Yeah, just show me where's pain. Yeah. Okay. This one, right?
Yes.
Yes. Okay. Just a second, okay? Just.
So this is also that, the whole process of the treatment. I didn't have any edit or cut anything. The whole treatment that scenario just like that. Okay, so I just want to show you guys, how do I treatment, how do I treat those kind of patient, and how's the result.
Yes.
So first of all, we use the clean, that the skin by our alcoholic, that the cotton ball. We have our gloves, and then from my fingertips to find the treatment targets of the nodules.
All right. Yeah. Yeah.
And actually, that during the treatment in the knee joints, some patients will feel kind of very soreness and a little bit sensitive. That's normal, so don't worry about that.
Good. Try again. To the back. Try again. Still there?
No,
Pain's gone, right?
looks like, let me try it on the chair.
Sure, you can try it here.
So this lady,
Yeah.
that couldn't believe that her pain is gone because the pain has been bothering her for several days. And then he tried again on the chair
gone.
to double check that the
See,
pain is
2
gone
seconds.
or still there.
Are you happy for that?
So much.
Yeah.
Yeah.
Okay, we're done.
So this two, that the videos just show you that what I do most of the time in my clinic to treat the pain. And maybe you ask, that what's that is a mechanism of the minimizing acupuncture for the pain treatment. How does it work? Why it works? And you can achieve the very good result right away. So next, I will maybe introduce those kind of things for you. First of all, I would like to maybe introduce the pathophysiological base of the minimizing acupuncture therapy. So minimizing acupuncture is a therapy that integrates traditional Chinese and Western medicine and is based on the 4 core series of abnormal tension theory, adhesion scar theory, myofascial trigger point theory, and the 3-dimensional meridian theory. This series explains that the pathophysiological changes, development of pain, as well as the source and the conduction of abnormal tension. Through that superficial blood needling, minimizing acupuncture needle can release deep pain, restore tension balance, eliminate inflammation and improve blood circulation. So it can quickly eliminate pain and nerve compression to help achieve remarkable long-term effect. So I can tell you that 2 patients after that treatment, that nobody come back because the pain is gone. So that's why it can, help to achieve the long-term the result. The core mechanism of the minizine acupuncture is correcting the mechanic imbalance caused by soft tissue lesions and eliminate inflammation reactive substances that cause the pain. Through the burning, leverage, the mechanic conduction or traction of the fascia, the traditional Chinese medicine's 3-dimensional meridian theory, it is becoming possible to treat deep lesions in a shallow, superficial layer. Forney considers that human body's repair function and self-regulation function, minizine acupuncture would maximize the self-healing capacity of the human body. So that's why that here I want to mention, guys, after treatment, some patients feel very good right away. Some patients also may be experiencing some kind of pain, temporarily getting worse, because this is the kind of process of our body self-healing process that can experience, the pain getting worse. So usually when you explain to the patients and then, not them, even take any painkiller, it's okay, or that use any kind of treatment. After 12 hours or 24 hours later, most of pain will be gone. So 4 series of the minizine therapy. First of all is abnormal tension theory, adhesion scar theory, myofascial trigger point theory, and 3-dimensional meridian theory. Abnormal tension theory, so talk about what is the abnormal tension, where it come from, and what that impact our body, because of first of all, the tension is kind of force that inside our body. That abnormal means that the tension is higher or lower than normal level of the tension we should have, like physical the tension. So once that soft tissue get injured, it will cause lots of problems, swelling, bleeding, blah blah blah. So all these things can cause that the tension become higher than usual. So here that I say cause abnormal tensions, it could have the soft tissue lesions, okay, and the muscle tissue damages, cause muscle spasm, and also connective tissue damages, scar formation scar formation, increased tension, and also if our body have a tumor, that the bone hyperplasia, it can because the shape has been changed, it also can cause increase our local the volume and size, increase the tension. And also from our spine, if that they have a scoliosis or spine curve could change, so that could cause also the attached muscles that tension changes either way from the transfer process or spinal process. And also if the patient could fractures, artificial joint replacement surgeries, it all can cause that the structures which can cause the tension changes. And of course, when our body get inflamed and get pain, and also our skin texture, will get changed, will become hardening or cooling. So this all can cause increased abnormal skin tensions. So that's the reasons cause the problems. Scar adhesion theories talk about when the soft tissue get injured, and then I say scar tissue is kind of consequences of the healing process. So here, soft tissue injury, inflammatory edema, and then tissue repair, scar tissue formation. And soft tissue injury, inflammatory edema, and then that exudation of surrounding tissues, collagen fibers penetrate deep into the other normal tissues, blood vessels, nerve tissues, and then can cause scar adhesion, form compression, pulling the normal neurological or neurovascular tissues, can cause the symptoms of the pain, of the tingles and numbness. Here, that's kind of pictures of the normal that the tissue of the muscle, that in case the muscle get injured and then the scar tissues, looks like that. And then when it get healed, it's kind of massive scar tissues inside or outside of the muscles. When this, scar tissue formed, it will increase the re-injury and also decrease the range of motion of the muscle related joints. So scar adhesion, it has tons of different kind of type of scar adhesion issues like bone, muscle, ligament, muscle and muscle, muscle and nerve, blood vessel, ligament and nerve, blah blah blah. All kinds of tissues can be that adhesive from the scar tissues. So that can cause huge issues. Here, that kind of blown and tapped to show you what kind of scar tissue could affect or impact our body. That's a normal blown, looks very smooth shape, very beautiful shapes. Once have that, that the transverse, the scar tissues tap, locked the bloom, the shape will be changed, the function will be changed. And also this kind of, that the this side, direction of scar tissues, it has less impact to that, transverse part of that, that the scar tissue to our body. So that's why that our treatment always follow our longitudinal, that the direction perform treatment. Here that, that once the patient have that, that the myofascial adhesion and fibrosis in the body, patients always will say, oh my God, I feel that my muscle or my body is catching, that sensations. You just don't feel right, okay? And also that adhesion anywhere in the muscle, tendon, or ligament can result in imbalance, degeneration, compression, and pain. So this is because of the effect adhesions have on the surrounding muscles and nerves. So scar adhesions will cause muscle to catch between each other, cause weakness in the muscle by shortening, cause repeated secondary injury, cause entrapment on nerve fibers, cause entrapment on blood vessels, cause local abnormal high tension. So that's why scar tissues is very important for our pain treatment. So same thing that the scar tissues, when muscle get adhesion, they reduce the strength by reducing the amount of functional muscles, limits mobility by reducing muscle length, and require more force to function within a normal range. So that's why it can cause all more troubles. That's why stick together. Here, kind of, that visual cycles of the pain and the scar adhesion tissues. That's why. I mean, when that that the injury happened, it will cause injuries, it causes scar tissues, and then cause the visual cycles, and the pain getting worse and worse. So that's why we need to break up those kind of cycles, and then to achieve the long-term result. So that's why that I say here I want just that to present that scar adhesion tissue, the lactic impact to our body is that that first of all, this is kind of my scar tissue is kind of body's that consequences, but scar tissues is a lactic tissue. It has that high the tolerance and the poor elasticity, so which makes it difficult for the body to digest and absorb. So when adhesion occurs at a certain point of part of these soft tissues, muscles and other soft tissues cannot stretch and slide freely in the body, causing imbalance in the body's dynamic movement, leading to physical dysfunction. At the same time, the adhesion is pulling and squeezing the nerves, causing pain, tingles, numbness, swelling, and soreness. So here the pictures show you that when that the scar tissue formed between the arteries, nerves, fascias, and veins, everywhere soft tissues, that absolutely that your body in trouble. Okay, so the blood needle that is a powerful weapon to treat scar adhesion, the pain. So here I say generally acupuncture needles can only penetrate the scar connective tissues, but cannot cut off the scar tissues. Only a blade can cut off the scar and the connective tissue, relieve its pressure and the friction on other soft tissue, eliminate the pain and numbness, and improve blood circulation to promote the healing process. So that's why that it's very important to use that the blade needles to do that. Okay, second that the series is from that that the myofascial trigger points. That is very popular, that words I think using that in the physiotherapy, massage therapy, or chiropractors, or pain clinics. because it has been over 50 years, that most of Western medicine believes this is the cause of the pain. Even some that research indicated that in the United States, almost 95% of the pain patients, that kind of pain caused by the myofascial trigger points. So what it is the myofascial trigger points, or we call MTRPS. Myofascial trigger point is that a hyper irritable spot, usually within the top band of the skeletal muscles, which is painful on compression and can give rise to a characteristic referred pain, motor dysfunction, and autonomic phenomena. So this is kind of that muscle fibers, that taut band, like this taut band, and then trigger points inside. So to my understanding, actually trigger point is kind of aging process, degenerative, disease, just like that our old the tire of the car. If it has been many years to using that, and when it will have the bumps, on the the tire, and then it get break out, and then the tire will be gone. So this is the same thing, because our whole life to use our muscles, for daily activities. Of course, some muscles were getting weaker and weaker, and then get damaged. Okay, because some research indicated that even when kid was 4 years old, they can find the latent, the trigger points already. This picture just shows that that kind of taut band here. Okay, that the contract muscle fibers decrease blood supplies, causing nerve irritation and pain from this kind of taut band. This kind of trigger point complexes. Okay. So trigger points, we have two different kinds of the trigger points. One is called active trigger points. One is called latent trigger points. They all have the tenderness, but active trigger points have the pain and also kind of referred pain. Okay, latent trigger points, it only have the tenderness. But if you pipette the patient, always can find that the nodules and their fingertips of this kind of trigger points. So it is kind of objective, that the pain, the nodules there. Of course, depends on the location of the trigger points. We also can identify or classify the trigger points as a central trigger points or affiliated trigger points. Okay, so that the features of the active trigger points, it has pain and tender, swelling, nodule, high the tension inside, and it has low pH, high acidity, high concentration of inflammatory pain substances, and blood microcirculatory circulation disorders. Okay, so it has these 5 different things. From this slide, just show you that the chemicals, that in trigger points, those kind of that TNF, IL6, that substance P, and know that the pine, this chemicals, PKN, there's all kind of the pain substances. This in active trigger points. Okay, the pH is very low here, but this kind of pain chemicals is very high. So that's why if you want to treat the trigger points pain, you have to wash out or remove this kind of that pain substances, and then the patient pain will getting better. So how to wash out to remove this kind of trigger chemical? So that is very important for our treatment. That's why in that physiotherapy they use dry needling. The dry needling is a big needles and go to very deep. And then they try to wash out those kind of chemicals to diminish the trigger points. But as a result, mini-zinc needles with a blade needle is much better than dry needle. Okay, so this picture just shows that the trigger points, skin, and the fascia, what happened. Actually, when the trigger points happens inside of the body, actually your skin also gonna change it already. You will touch the skin, you will feel skin is kind of harder, cooler. Okay, less brightness. Okay, so that's all things you can tell right away from the examination for the patients, before the treatment. So touch the skin, you will find right away where that should be trigger point is, and then to treat that part, always you can achieve the best result. And also that sometimes I'm just thinking what it looks like, trigger points. We understand it's inside of muscles, But actually, right now, lots of research indicated that could be that also in the skin, in the ligament, in the tendons, whatever. But to my understanding, it will just look like a cold sore. That we all have experience of cold sore, right? The cold sore is kind of swollen like this, but also it has a gap on top. Okay, so when you press it, it's very painful. So, but after healed, no pain at all, no scar tissues. So that's why I believe the tall band and trigger points are immature scarred tissues. Yes, yes. So this is active trigger points. Looks like that. Cold sore like that. There's all kind of semi-mature scar tissues. Semi-mature means that this scar tissue is not 100% matured, but it has some scab on top. It has inflammation inside. It's very painful. It's swollen. Okay, so that's exactly, if you don't know what is that, trigger point, think about that you are cold sore, and then you can tell what it is. That is cold sore. That trigger point just happens in the muscle. Okay. And from the physiotherapist, from massage therapist, the physiotherapist, for those kind of trigger points, what kind of treatment usually they give? They give patients, called deep stroke by the ball to smash the trigger points. So you think about that. That's very tiny, trigger point there. There's a big ball, want to smash it. If it is possible, yes, it is possible, but it is very difficult to do that, because when you just that strokes that your balls on your back sometimes maybe right, sometimes may irritate your trigger points. So that is hard for people to do that. Actually, I do have lots of the massage therapist patient, and I ask them how to treat those kind of trigger points. They say use the ball, but it's very hard for them to achieve the result. Sometimes they use a deep tissue massage, of course very painful, but still you can't to remove those kind of trigger points sometimes can cause more that pain, more inflammation from treatment areas. So that is kind of things. Okay, so here that I just maybe to mention that the trigger points application points and total band scar tissues, it has a kind of relationship between the trigger points. It has tenderness and pain. Adhesion, the scar tissues has pain, nerve, and compression, but they all can cause abnormal high tension. When this happens, and then can cause local symptoms and also can cause distal symptoms by the meridian. That the meridian can transfer those tension from local to distal areas. Okay. So here, what is the most effective method to break up the scar adhesion tissues and trigger points? So minizane acupuncture needle with a sharp blade. So I have cartoon here that achieves, because I found it works very, very good for those kind of issues which cause the pain. Okay, so this kind of pictures of that traditional acupotomy needle. I mean that with a sharp blade, that all the needles go big. So that's why they can go deep, to perform the treatment. But I don't use this kind of needles, but I just show the same, that the idea. It has a blade on top. Okay, you will have cut, that effect, and also it can stimulate our points. Three-dimensional the meridian theories, that from here I just want to use this to explain why sometimes we treat kind of pain, distal pain, that in another different areas, because of the pain, the abnormal high tension can transform from the one place to another places. But every time when we treat the pain, we have to find the cause of the pain. We have to find the site of the cause of the pain. So, and then we can treat the pain to achieve the best result, a long-term result. So this is that three that that the side of kind of that pictures here. It has that the transverse planes, the frontal plane, and sagittal plane. Show different kind of ways. Actually, our meridians is kind of three that that dimension. That from inside to outside, from that left to right, from the low to low part to the top part. Okay, they all can collect it. So all that that meridians, not just that just a double that plane. Actually, it has a triple plane. Okay, so that we should understand that. And also that in China, some doctors also that have some of their own that series to explain how to use that the minizin acupuncture needles to treat those kind of pain. Is I also have what they call Wen-Po 4-guide wire balance theory, ball string theory, leverage theory, and manufacturer chain theory. From this kind of theories, it all mean that discussing that biomechanic the imbalance, and then how to use the minizin needles to correct the balance from the biomedical part. Okay, so I want just to introduce this to you guys. This we call Wen-Po 4-guide wire balance series. That's a very common thing. We can see that in countryside we have the the electric pole there, and we have the wire to hold this pole in straight. Yeah, this series talk about in case we have the increase the tension on the the wire A, the whole systems will hold this kind of pole in straight, and then it meanwhile the tension on the B and the C and the D wire will increase too, and then it will to maintain this pole that in the straight. For example, in our bodies, for example, that here is kind of fibrous bone here. We have that IT band, ETF and muscles here. We also have quad muscles. We have hamstring muscles. We have adductor muscles. Is surrounding this kind of bone. Sometimes we found that when this kind of, for example, that the ETF, and also IT band get tight, it can cause pain inside of the knee, or it can cause pain, in the groin areas. Sometimes it can cause pain that in the hamstring or hamstrings, and also that in the the quad muscles pain. So depends on persons. Some people may be more sensitive, for pain. They will show pain in this area. So that's why. But from there we all have to looking for, because that the IT band, ETF muscles, because that is most easy get the injured muscles. When this muscle get injured, get the tight, get shortened, it will increase the tension, just like A, on this whole areas, this whole systems, and then it will automatically cause that the tension increase in the B, C, and the D. Same thing in the quad muscle, abdominal muscles, and hamstring muscles, and then you will know which part caused the pain. Get the pain, we have to treat the cause of IT band or ETF, and then the D pain may be getting better. The growing pain we are getting better, could be okay. So that's what we call Wen-Po 4-guide wire balance theory. Second, we call the ball string theory. Ball string theories we talk about in our spine, because our spine we have a full curve, physiological curve. Okay, from cervical curve, thoracic curve, lumbar curve, and sacral curve, right? So this all curves just like the ball, and the muscles on top of that the spine just like string. Okay, so usually that when to the ball string, so when archer draw the ball like this, the highest stress ties are junction of the ball and the string here, hand and the ball here, and hand and the string. So that's the very common way that we look, that the tension could be highest there. Same thing in our spine, we have 4 curves. Which part is the tallest part or lowest part? There's always kind of tension, highest part, and where they get injured in these areas. So when we treat a back pain, we always kind of looking for the curve or spine, and then find that the tallest part of the, for example here, thoracic, that maybe T7 T79, that's maybe tallest part, and then it could have the pain there. If we treat this part of pain and then whole muscle, maybe that the whole back, the pain will getting better. sometimes when we treat the lumbar pain, we are looking for this kind of north part of the lumbar. And then that, when we treat this kind of pain, the muscles and tendons, and then this area's pain will be getting better right away. So that's what we call the ball string theory. Leverage theory. Oh, what happened? Oh. Something happens, I'm sorry. Sorry about that. I don't know what happened. But anyway, this for the leverage series, and from this kind of leverage, series, we can remove that kind of tension from here by, press, the tension from here, because of you want, that, to remove this kind of W up, we have to give the press, the force on the P. Okay, so this is sometimes we talk about treatment on that that the spine muscles when get that deep muscle got spasm, and then it will cause tension from the transfer process and the spinal process, and then the pain will be sharp and deep. From here, if the pain from L3, for example, muscles has been that that the spasm got injured, the patient will experience very deep pain there. But if we use needles go deep to touch the transfer process of L3, it could be the risk to touch the kidney underneath of this kind of bone. But from this kind of series, if we just remove the tension from the spinal process, and then meanwhile the tension on the W will be removed. So that's why that from here we just work on the spinal process part, tension part. Use mini-zinc acupuncture needles to relieve the tension. When this tension gets released, this tension will be getting released, and then the pain will be getting better. Okay, so this is kind of way we call leverage theory. And last one, he called the myofascial chain theory that I use, three-dimensional that meridian theory. But same thing, because he believes that our bodies, that skeletal muscles and the fibrosis connective tissues form an intensive body-wide network of myofascial chains. As the fascia can modify its stiffness, strain transmission along these meridians is possible. Some research data point towards existence of a strain transfer along myofascial meridians. So same thing. For example, from here A and B, if you have the tension from A by the chain, and then it can transfer to the B. But if the B side has more pain sensitivity, and then even the tension from A, the patient don't show any pain, but they will show some pain on the B. In this kind of scenarios, if we just treat the B, the pain maybe doesn't work. We have to treat the A, but we have to understand why the pain from B comes from A, how and where it is. Clinically, we often happens that some patients come here for heel pain. Most of the time, believes that people think, okay, heel pain must some pain, some injury in the heels. But sometimes we found actually patients the pain from here is caused from the lumbar areas or from the spine, from cervical, that the neck areas. And if we find that this kind of heel pain is kind of low back related or that the leg related, if we just treat the leg lumbar, and the heel pain will be automatically getting disappeared. So that's the way we call the myofascial chain theory. So from this way, we don't have to looking for where's pain, where to go. No, that's very low. We have to find exactly the source of the pain and then treat it. Okay, so right now that I'm talking about benefits of the mini-Zen acupuncture. Mini-Zen acupuncture can directly break up the scar adhesion tissue, which locks muscles and joints, compress blood vessels and nerves. Okay, mini-Zen acupuncture directly break up the taut band and trigger points, drain out the biochemical pain substances from swollen hyper-irritable spots, remove compression on blood vessels and irritable nerve fibers, improves blood flow to promote the healing process. And also it can promote blood circulation, supplies more nutrients and oxygen into the injured muscles and tendons. And also it can, chronic intractable pain will be cured, joint range of motion will be restored. So normal life will be achieved. So that's kind of way, that benefits of the mini-Zen acupuncture.
Okay, so that how do you feel generally after treatment? Everything is okay?
Oh, I feel great. A lot of the pain I was struggling with, it seemed to almost completely disappear. It was interesting because I could feel, the quick pokes, and then when you were touching it and it was sore, just like that, it's completely gone. It feels like almost 100%. It's great.
That's great. Okay, sure. Thank you.
Okay, so here that I say that that popularization and the learning mini-Zen acupuncture therapy. So that's why that we planned before. 2 years ago we planned to have this training course because it will help you that acupuncture therapist become the doctor with a more comprehensive acupuncture techniques. Okay, and for treatment of common disease achieves a much poor effect with half the effort. And you are aware of how to treat difficult and complicated disease, become the top expert in the treatment of soft tissue injury pain syndromes. Okay, so we have that that the website we call ccecatcm.com. So that we'll show you after. Okay, so that I think that we talked about already. Maybe another 30 minutes. I just talk about how to use mini-Zen acupuncture treatment in the clinic. Okay, for clinic applications. First of all, that we say that how to use the mini-Zen acupuncture to treat the pain. First of all, we have to listen to patients that the main that the complaint, and also that the patients the action, and then to analyze the pulling pain or contraction pain, and then find the suitable treatment position for the pain treatment, and also that we clean the treatment areas first, and then we use our fingers to pipette, to find tight muscles and trigger points, and then that use some index fingers, middle fingers to confirm the nodules for the pain treatment and the muscle spasm, and then press the treatment site, and then insert the needles to cut off the painful the nodules, and then that during the process you can hear the cutting sounds like cracking sounds, and also in order to adjust the therapeutic effect following the treatment, have the patient to get up and repeat the action that was painful before the treatment. And we also have actual operations after treatment. If a patient still shows some pain with some kind of movement or action, ask the patient to redo it, and then hold that that position when pain happened, and find that the nodules, and then give actual treatment. Usually we get the result right away. And how to that looking for that the MRI treatment targets. Where to find those kind of scar tissues or the trigger points. Usually that I say that when patients perform the pain, and always they have to looking for above part of the pain areas, not just looking for the pain areas. For example, if a patient have a pain on the wrist, you're not just looking for the wrist part. You have to looking for the elbows or shoulders or neck. That could be the cause of pain in the wrist. So that's very important. Okay. So same thing when patients have that the calf pain on the legs. You can't just treat the calf. You have to looking for maybe mid back or low back. Some patients have some issues there. After treat that part, and then the calf pain will getting better right away. And precaution of the treatment of the mini-Zen acupuncture, of course, the same as the regular acupuncture treatment. If patient have the infection disease or high fevers or extremely hungry or that very extremely tired or nervous, we don't treat this kind of patients at time. And also, if patient have a pregnant, we don't treat that woman in the lumbar areas, abdominal areas. And also, if patient have that skin that infection disease or have diabetes, or bleeding disease, we don't treat them at the moment. And also, we try to avoid the treatment in the deep, go to deeper, besides that the big muscles in the nerves. And of course, here how to decrease the pain. I say that I don't want to say this is pain-free. This is still have some very mild pain. We do have some things we can, reduce the pain of the treatment. First of all, that as patient, I'll perform our treatment, supposed to be a bit slow. When are we cutting? 1, 2, 3, 4, we can count. And also that we have to get a regular, accurate treatment places. Okay, and also that we need a very good quality of the needles with a very sharp blade of the needles, and then it can cause less pain. And also, right now, most common I use is I give patients candy. Typically, I say when patients sitting there for treatment or standing for treatment, the candy is very important. First of all, help to reduce the pain. Second one, to prevent the fainting, reaction from treatment. Okay. And after treatment, what should be careful about that after treatment? First of all, that in case during treatment you get some bleedings, press the part for 1 or 2 minutes, and also you can use that polysporin that to prevent that any skin infection, treatment infection. If you worry about that, but so far in many years I never used polysporin to that to do that. I never do that. But if you want, you can do. And also that if your patients after treatment feel is kind of painful, they can take some painkillers after treatment, because I say sometimes it could be a delayed pain reaction after treatment. So you can let patients say, okay, I want, maybe you can take some pain medicines, And also that after treatment, patients can take shower, no problems. They can do whatever they want, no problems. But the important is that don't ask them to do any exercise, that whatever exercise it is, don't do that. Because I always explain to them, this treatment will rebalance your system and to heal your system. So you need to rest, okay? And also treatment, that after treatment, only things don't want to ask patients to do is to drink alcoholic, the beverage, because alcohol can irritate the pain, that. So don't tell patients don't drink any alcoholic beverage. And treatment frequency that usually take 3 or 4 days once the treatment. Okay, so that I think that I talked about lots of that the basic that the series and stories of the minizing acupuncture that therapy. Next few maybe 20 minutes, I quickly talk about the treatment I used for that. First of all, for soft tissue injuries, because in our clinic most of our patients' pain is kind of soft tissue injury pain, right? They have pain, tenderness, nerve compressions, or physical disturbance, or autonomic the dysfunctions that could happen from all kind of patients. And then that with our minizing acupuncture treatment, always I can achieve the best result. So for this kind of soft tissue injury pain, we have to analyze this pain is kind of the pulling pain, contracting pain, that we have to looking for which muscle has the pain, and we're looking for the muscle's origin and insertion the part, and then from there looking for the kind of lodges, the scar tissues or trigger points, and also we're looking for the the bundle of the muscle, that is any kind of taut band inside, and then from taut band we're looking for that trigger points on taut band. Okay, so that's the way. For the nerve in treatment, the disease, because this is very common. Lots of patients come here not just for the pain, and also tell you that they have tingles and numbness, that on the hands, on the arms, on the legs, on the limbs. So that's very common. So when we treat the pain, when we treat that tingles and numbness, that of course the same procedures we have looking for where is the problem, where is the source of the pain, where is the source of that the tingles and numbness, where is that the nerve has been compressed. And then when we find the places, and then we just perform the minizing needles to break up those kind of scar tissues surrounding that the compression part, and then patient will getting better right away. And also that we can use a minizine acupuncture treatment to treat the female breast pain. That is very common too. Lots of female patients come to clinic because they have the pain in the front of chest, and also sometimes they tell you directly because the breast tender, painful. So actually, when I'm a young girl, actually just 24 years old, a few years ago, her breast pain was awful. The pain was last around, 6-7 months before come to see me. So he couldn't sleep at all at night. And after a few session treatment, her pain is completely gone. So that is very good. So for this kind of breast pain, of course, we have been looking for those kind of pec major, pec minor muscles, and also we have been looking for the back of the like T1 to T4, T5, that areas, any kind of tender part. We have to treat that part, and then we can achieve the best result. Also, in the last, 10 years, I also used my minizine acupuncture needles to treat kind of COPD, asthma too, because we have lots of muscles is kind of, the breast related, so that's why that when those muscles get tired or tired, and then when we use minizine acupuncture needles to relieve those kind of tension on these muscles, and patients, that COPD and asthma and cough, we're getting better right away. So that is very good for those kind of COPD and asthma patients. And also that I use the minizine acupuncture needles for the eye disease, tinnitus, and deafness, because I found before lots of patients are suffering from those kind of ENT problems, the tinnitus and also eye issues. We believe that I have some problems, ear has some problems, but actually after I examined, and I found that actually all from the neck issues, from neck, because neck muscles get tightness and then can compress the blood vessels and then decrease the blood flow to the eye, to the ear, can cause the eye disease, vision problems, or tinnitus and deafness. And also sometimes nerve has been pinched and then cause ear aches, and then that can cause the migraine headaches. So that's all very common too. Next, I talk a little bit more details of what we call C-vein transfer process syndrome. This is very common because lots of patients have the pain, neck pain. Actually, one side will have the pain beside the SCM muscle. We can pipette this kind of first C-vein transfer process here, and then that the patient was very tender, very sensitive. And also patients not to have pain here, they always complain the migraine headache on this side. Have dry mouth or dry eyes, and all have ear aches, and anxious, depressions could happen all from these areas. So when we treat this part, and we get result right away. Because from the C-vein transfer process, we have the few that muscles that are collected. When it's kind of obliques, capitis superior, and also that obliques, capitis inferior muscles. This inferior muscles, superior muscles, attached there. So we have to work on these two muscles and then release those kind of pathways, and then we can achieve the result right away. The reason called the C-vein transfer process syndrome, because of course from our habit of the working, our lifestyles, that is, for example, long-term headache and low head, work, cause the muscle strains. Long-term tilting head to watch TV can cause the one side muscle strain. And long-term high pillow sleepers or sleep on one side can cause the problems. So symptoms, that from C-vein transfer process could be the dizziness, headaches, tinnitus, deafness, TMJ problems, increased pain, opening mouth or chewing, dry eyes, eyelids, or prominent eyeballs, the trigeminal, neuralgia, pain in the temple, one side facial pain, numbness, and muscle spasm, paralysis, toothaches, anything that it happens just work on the one side, of the eyes, that the tooth, whatever. Most of the time, I believe that is kind of, when this side, the neck issues related. So you don't have to, ask patient to see the specialist, because most of the time specialists, they can't recognize the cause of the problems, so that is the way. The diagnosis, always patients have dizziness, pain on the side, forehead, or eye discomfort. And head extension resistance test positive, tender lodges on sebum transfer process tips, the tender lodges on lateral side interior, the knocker line. So that's kind of things, that we can make diagnosis right away. And treatment, that very easy. Just when ask patient, lying prone position, and then we're working on the kind of, oblique, that the superior capitis or oblique inferior, capitis, all the two muscles, to see which muscle get tighter, and then we treat these muscles. But of course, we have to treat that kind of tip of sebum transfer process. When it is in, and then we can hear the cutting sounds, and then that after that, patient will tell you, they're okay, that the eye become more brightness, pain getting less, that more they feel more comfortable. This is case one case I just want to introduce guys that because this lady is for cause from the sebum transfer process and also has optical, that the neuritis, and anopsia, so that they had lost almost the visions. The time he was here, that 2019 January, he was 48. He complains right eye optic neuritis for 8 years with headache, dizziness, blurred visions. And tenderness, exam, you can find tenderness on the right tip sebum transfer process with tight muscles besides C7 to C7, blah, blah, blah. So treatment, we just got, minizine acupuncture treatment. Usually after, that a few sessions later, and she told me her vision gets much better. And this patient told we treated 10 sessions. Here that he got the eye doctor's, exam before the treatment, he got the right side, right eyes, left eyes. Right eyes, you can see that a lot of dark part is no vision at all. This gray part is almost, that the vision has been reduced, and only almost no place is kind of bright part. So her right side vision is completely almost gone. He couldn't walk at all. That time he was out of work from disability from the visions. And left side, it has a big lot there, but it has a better vision than right side. After 5 sessions, you can tell that the black part almost 80% disappeared. Only after 5 sessions, and that much better, and also show some white part, some vision come back, and also the left side, that bright part getting bigger, and that before it has black part there, and disappeared after that. After 10 sessions, you can tell that the black vision part, almost blind part, almost 90% is gone. So most of vision come back, and also that the left side is also getting much better too. So after 10 session treatment after, her that the leg pain is gone, her vision back, and she went back to work. So the result is very good. It was very good, and even the eye doctor surprised. They said, "What? That because he has been suffering from this disease over 3 years, and then just over 10 sessions, and everything back to normal." Actually, this is a lady that I treated, and this her that eye visions. That's here I give her treatment, and quickly that we're just looking for that kind of, how do I treat the patient to the time.
I felt very well after treatment, no pain at all.
Yes.
And
how about dizziness?
Dizziness gone.
That's great.
Yeah, so no pain. I'm saying I felt very, very well.
So that we can get the treatment again today. That we'll see what happened. Okay. Yeah, that's great. So that we just give it time. You can get a change. Same as before, just lying, stomach pressing down.
Because patients come here every time, we still treat on her neck and shoulders and upper back areas to loosen up the muscles in these areas, because those tight muscles can depress the blood vessels, which that supply the blood flow to the eyes. So once the muscle get relaxed, and then the muscle blood circulation getting better.
Here, and then can cause eye aches, can cause headaches, can cause neck pain, can cause shoulder problems, all from there.
Where is C3?
Yeah.
Where is C3?
C1. C1.
C. But I saw one.
Here, around here.
This is 3. And where is 1?
Yeah.
Oh, this is 1.
This 1.
And
Just
where is
behind.
3?
Straight down a little bit. This way. Yeah, where I see. Very, very close. It's hard to make just the 1 centimeter differences from 1 to 3. Come down.
Okay, so this is the patient, that the problems. Second one, I would like maybe introduce a little bit more details of the coracoid process syndromes. That is very common too. I say lots of ladies complain that that the pain, the breast pain, and also that the front chest, that pain here, that generally from acupuncture treatment, most of the time, works not very well. And also patient after treatment still lots of pain. But if we know how to treat it by administering acupuncture treatment, I can promise after 3 sessions, pain should be much, much better. So this is kind of, we call the coracoid process syndrome. This is coracoid process, from the scapulum, that the bone in front part, it has, 3 that attachment. This is the pec minor, that pectoralis minor muscles, and also it has, that bicep muscles, and also it has the coracoid muscles too. So it has the 3 different kind of muscles attached to this kind of coracoid process of the scapula. The diagnosis is most of the time very easy because patients complain the pain in the front of chest and in front of the shoulder too, and also local part. You can find very, very sensitive. The pain on the lodges on the coracoid process. Okay, so moment that the interruptant is that it's hard to move the shoulders and feels kind of pain when you move around up and front back and forth of the shoulder moment. And then that pain is aggravated by the passive extension of the arm or active reflection of the elbows. So that's when the treatment, we usually be looking for the tendon nodules on the anterior lateral side of the coracoid process. Okay, so usually we ask patients, supine the treatment, that upper limb straight with the palms up. The purpose is to make the distance, between the nasal tubercles of the humerus and the tip of the coracoid process easy to identify and treat the tendon nodules. Okay, so that's after treatment. Usually that works very good. But I want to say on this kind of treatment, pain in the front part a little bit more sensitive than treatment on the back. So, but most patients can tolerate. Should be no problems at all. So this is ladies, I treat that part, treatment. Just take a look. Quickly take a look.
Your position.
Okay.
Your
there.
pain.
Yeah.
Is pain here?
It comes, okay, so let me, should I stand?
Show me. Yeah.
When I stand, because that's when it happens more and it's here.
It's here, right?
Yes,
That's kind of
there,
pulling
yes.
pain. We say the
Okay.
biceps hasn't been pulled. That's why that when that the patient that arms back to the that side. Yeah, and then we're looking for the the coracoid process.
And then we can tell exactly here, right?
Yes, that's it.
Yeah, that's it.
Yeah, that's exactly on the coracoid process.
Candy is a good idea.
Yeah.
So I give patient candy, so she likes that. So for this treatment, we don't have to leave the needles inside, just up and down and take it out. And the treatment is very superficial. We don't have to go very deep. Our purpose is just break up those kind of nodules, around, treatment areas. That's it.
Yes.
And even with the scar tissue.
Yes. That
The position?
Yeah.
And even with the scar tissue.
Yes. Are you okay?
Yes, I'm fine. Just
Now we just quickly go to the part.
Yeah, try again. Get up to see how to feel. Yeah, much better now, right?
yeah, but
Okay.
it's still, I mean, obviously,
Yes.
it's not going to go away.
Because that's why sometimes
Yeah,
finger from
and here-
leaders.
Yeah. Oh, yeah. And see, but when I go higher,
Yes.
then it makes a
That's what happened. Because I guess lots of times I was compensating and just
Like
doing
this
this.
way, yeah.
Not.
But right now, that you can turn aside to see how far it can go. As high as can go.
Yeah, see, now I can feel.
That's great. Wow. So right now, that do you have any pain right now? That
Yeah.
hold this position. Where's pain? Let me see.
The pain?
Let me check up.
Okay.
Yeah. So from here,
Yes.
still here.
Yeah. Like
Okay.
I think it goes, yeah.
Okay. So you can try a little high. Where's
Right
pain?
here.
Okay. So hold it. Okay.
So this is this kind of treatment we call that when patients hold the position for pain, we just give one extra, the treatment, that to find exactly which part lock the muscles of the nodules, and usually the patient should feel better right away. But this case is because the lady has been injured many years, lots of scar tissues there, so that I give her more treatment than that.
Okay. Back now. Relax.
Uh-huh.
Yeah. Yeah. Let me see. Okay. This one.
Okay, so that's it. And then that next I will maybe talk about, that the prolapse tears syndromes. This is very common too. Lots of patients complain that, tingles, numbness on the fingers. Typically that the median nerve has been compressed. And then that you would just treat lots of people or lots of doctors believe that is kind of, that the carpal tunnel syndromes. But to my experience, I found most of the time it's caused by prolapse tears syndrome. Nerve has been, compressed from the elbow areas. So that's why the patients experience with the tingles, numbness in that their, the fingers of the first, the 2.5 fingers, the median nerve has been compressed. Okay. That the manifestations and diagnosis, and typically that onset is slow and symptoms often develop after repeated hand grasping or prolation activities such as playing the ping pong. Okay. So the pain is uncomfortable and the thumb index fingers are numb. So that's kind of typically that median nerve has been compressed. So that's the way. And all this kind of tests, that I conclude that. And for treatment, basically that we treat that, that this prolapse, the muscles, that origin part and the insertion part. And then after that, patients should be get better right away. Even during the treatment, the patient tell me, oh, my tingles numbness is gone right away. So that's, if you know where are the problems, do the right treatment, you will get the right result. Okay, this is that the treatment for that part. Most of the tingles numbs on this part, right? Yeah, but I can tell. So right now, if you have tingles numbs on this part, right?
Yes.
Okay. Yeah, the patient right now that she feel, the tingles numbness on the part, but also that you can find that the, that the tendon nodules around the prolapse muscle, that the origin part. Okay, we just go through quickly. Good. Yeah, you can try to see how to feel now. Still tingles numb, so it's better.
It does feel a little bit better, yeah.
Yeah, it's nice, right?
Yeah, I actually, these two fingers, I can feel more.
Yes, yeah, so that's why that, when we resolve the problems, your sensation will be back right away.
Mm-hmm.
Yeah, that's kind of, yeah, that's kind of resolve the problems. Okay, so that is kind of prolapse, the syndromes, the prolapse muscle syndromes. And then that next one, we call that lateral epic, condylitis, we call tennis elbows. But we sometimes we think that, that the lateral, that epicondyle, that condylitis, always believe that's kind of, that the problem from the inflammation of the tendonitis. But to me, no, not always. Sometimes just muscle pain around that area. Sometimes it's kind of typically that lateral epic, condylitis, there. Okay, so that is when the treatment is totally different from there. Yeah, so that we know that the muscles, come from there and then go to the extensor muscles of the wrist, that from there. And then that for the treatment, that usually that pain most of the time on the lateral side of the elbows, right? And patients, but it has 3 different kinds of things. One thing is that elbow pain could be caused by the carry some stuff to feel more pain. Second one that, some patients just sweeping that the extent, that elbows feel more pain. And also that the last one is that, when twist or open the door, they feel more pain. So last one is, it is kind of, we call that, lateral epicondylitis. Okay, for first two, it is not from that, that tendonitis. It is from the muscle itself, that is called biceps or tricep muscle problems. So for the treatment, that we know that the different kind of pain from the elbows, and then we can choose, different kind of, the treatment for that. And if we choose right, if we can make a right, accurate diagnosis, we can make right, that result. So usually that I say that if your patients, from lateral side, elbow pain caused by more carry steps, that we say the bicep have some issues, we treat bicep and muscles, that issues. If patients, because from the extent, our elbows cause more pain, and then that we treat triceps, muscle problems. And if patient pain exactly on the lateral epicondyle, this one, and then we just need to stay here and then just go to what we call cross insertion treatment, and then to remove this kind of inflammation on the the bone, and then we can achieve the best result. Because time issues, I don't have time to do that. I do have a video for that too. And also that we call another one we call the tarsal tunnel syndromes. Tarsal tunnel syndrome, that is very common to the patients suffering from the that medial ankle pain, heel pain, and so that the foot pain. We call that the plantar fasciitis, but it is not the plantar fasciitis. It is caused by the tarsal tunnel syndromes because of because the nerve has been compressed, that, and cause the problems. So we'll show you what it is. Yeah, this is tarsal tunnel syndromes because when we have the nerves come from a posterior tibia artery and nerve, pass from this kind of that the tunnel, we call tarsal tunnel, and then because this nerve distribute the heels, the sole of the foot, and if this part gets compressed, and then patient will feel tingles, pain on here, tingles and pain on the that the sole of the foot, and also the toe. So that's the problems. Usually that when this happens, our acupuncture doesn't work very well because I treated one patient before. I use the mini zinc acupuncture needles. I treated patient 5 sessions in locals, in distal areas. None of worked. And then when I use mini zinc acupuncture treatment one time, the pain and tingles numbness is gone. So that is very important. If you know what happened to the patient and get the right treatment. And the diagnosis of tarsal tunnel syndromes, I don't go that the right details because if you are interested in, you can search online. You will get lots of information for that. Okay. For treatment, basically that to me, I usually treat the muscles related to this kind of tendons. We treat this kind of the tarsal, the tunnel, that's which part patients will always have some kind of nodules, tender nodules there, and then use mini zinc just cut those kind of nodules. You have to that following that that the nerve, the directions, you can't cross cutting. You have to that go right direction to cut that, to make sure don't damage the nerves and the blood vessels in that median, the anchor site. Okay, so that's very important. So that you have to that shoe bind or sideline. The treatment is the same as usual. That yeah. Okay, so that last one that we call the North Cross syndromes, that maybe lots of people don't know that what it is, but it is kind of that patients happens very often, that in our clinic patients have tight muscles on the back and tight muscles on hip flexors and have weak abdominal part and weak the gluteus maximum muscles. So that from mini zinc acupuncture treatment, most of the time we treat the tight part, tight muscles. So we treat tight that the that back muscles, tight, that the flexors. Okay, so we treat this part. So this is kind of no cross syndromes. Okay, that is weak, this part. Now here actually we have 2 videos. Maybe I don't have time to show how do I treat those kind of patient. Actually, he is at the the doctor that working in that health center. That he has, you know, that the upper cross syndrome and the lower cross syndrome. He has been here in my clinic over 10 sessions. He feels that my treatment works much better than before. He went to another doctor, you know, that treated, you know, that conditions. He feels that minizing acupuncture really can release that his tension. And after treatment, he can right now walk around in maybe that 2 hours, 3 hours, no problem. Before, only around maybe 10, 20 minutes, you have to stop. And also with that, the minizing acupuncture treatment, we also can use for wet nose, you know, that to directly, you know, that work on the regular acupuncture points and the place where the fat tissues are accumulated. Use that the minizing needles to break up those kind of, you know, fatty materials, and then that, you know, always achieve that better and faster result than regular acupuncture needles. And also right now that it is very popular in China that people use that cosmetic, you know, that for remove wrinkles and scars on the face, you know, and tighten that, you know, that face, that the skins, and seems to work very well. And lots of you know, the doctors make huge money from this kind of treatment, you know, because all ladies, you know, that want beauty, so they won't spend money, you know, to do that. And also they believe that's kind of natural, you know, no, you don't have to inject any kind of chemicals inside or the gel in the face. And yeah, it's more natural way. So it is you know, that works very good. Actually, I treat a few patients in my clinic for different kind of, you know, scar issues on skin. Works very, very good, you know. Okay, so that is part of the, you know, that introduction of the minizing acupuncture. And I mentioned before that 2 years ago that we also have a plan to, you know, have, you know, minizing training classes, you know, that, and then that time, because the pandemic that interrupted our plan. So, but anyway, I introduced my training classes in 2019, 2020. This is in my clinic, you know, I have people, doctors actually that come from Edmonton, Calgary, Toronto, Vancouver, you know, that to learn that minizing acupuncture in my clinic. And after that, the training, right now, I still have contact with them. They all practice every day. They are very happy. They are happy to learn from my clinic. This is training classes during the conferences in Vancouver, Toronto, and San Francisco, you know, in 2019. And all patients, all students are still practicing that. They are also happy too, even that I just give them 1 day training, you know, that, but they got a very good result. And also that this is a 2020 that I have training classes in Winnipeg, you know, for the PT that in that River Heights, you know, the physiotherapy clinic. And, you know, that seems they are very happy after, you know, that training. They also that use them to treat their patients, seems to work very well. This is testimonials from that, you know, that those kind of physiotherapists, you know, that they tell me what happened after you use the minizing acupuncture treatment, so that maybe I don't have to read it for you guys, because generally they are all giving me 100% positive, you know, that feedback from that, you know, from treatment. So that's the way. And yeah, so that this another testimonials from another, you know, that the trainings, you know, from the physiotherapist. Yeah, so that one. Okay, so that, I mean, time's almost down there. So that last one, I just want to introduce right now, I have minizing acupuncture online training programs, because that maybe some people know already that 1 month ago, I have the public, you know, that the seminar that, you know, for introduce my online minizing acupuncture, you know, training courses. And after that, you know, that the public, you know, that the seminar, right now I have almost 30 students come from our world, from the Canada, States, Europe, England, you know, Germany. So that yeah, so they are right now still learning and online, since they're very, very happy. So here right now that I have the, you know, Chinese, English part, you know, that the minizing acupuncture English course, you know, right now that our prices is $498, you know, for that, you know, that for this online course, and plus, you know, I give you 5 boxes of this needle free, the needles for you to give you practice. Okay, and also we have the Chinese, you know, style of the, you know, online course too, the same prices, and also I, you know, give you 5 boxes of the minizing acupuncture needle. You can practice in your clinic. So this kind of, you know, that the lessons, we have the 11, 17, 19 lessons, you know, there. So we have the treatment for the whole body training, that from neck to the back to the arm to the shoulder to the everything. Okay. Okay, so that is kind of that the register that online course right now, that you will get huge discount, that anyway is a bonus from there. So anybody want to learn, or just contact me, and then that and also that you guys will come to my clinic for practicing too, that watching that the treatment, watching my diagnosis, but the price is different. We can discuss that personally after meeting. And also last one that I want to introduce the mini zinc acupuncture needle. This needle that is my clinic is that the only one distributor in Canada to sell this kind of needles, because from Health Canada, that the medical devices license is called, English name is a flat head needle. Okay, so that right now the brand I'm using is called Zagu acupuncture needle. Zagu, the brand, the mini zen is my Chinese name for the this name. Okay, so this is kind of the box of the then this is the needles itself, just like a 1 inch, that fine needles. And this is kind of that phone numbers and all the online the information. Okay, so if you have any questions, that you can let me know, and then that I would like maybe I'll answer you, that right now, or that you can maybe that text me my phone number, 431-588-4888. So that is kind of since that you can, and also that maybe you can scan that that WhatsApp, that my code, and for any kind of information if you want to know. And thank you very much. Thanks again for that MPAA association invited me to have this seminar to our members. So it's my proud that to be here again after 2 years. That I'm leaving from the president position. But anyway, that I'm still paying lots of attention on our association. I hope that our association getting stronger and bigger in the future. Thanks again. Bye bye.
Thank you very much, Coach Yan, for your very informative presentation today on mini zen acupuncture therapy. Your presentation provided our members with some insight into the various therapies and techniques available to expand our practice in acupuncture. Just a reminder for our members that you can become more knowledgeable and skilled in the use of mini zen acupuncture by enrolling in one of Gojian's courses. Again, thank you. It was a pleasure.
Thank you, Josie. Yeah, thank you. So any person have any questions, I can answer you. If no questions, that is fine. Let me see who is there. Community is also from that. Okay. Oh, yeah, Angela. Yes, yeah, Angela actually that time attended my training that in the physio clinic. Yeah, so that she used that. That I really appreciate that you give me that feedback right now. I won't talk to you though, but it's great. So anyway, and any persons that interested in, and then just let me know. Okay, so of course I will try my best to train you, become the qualified mini zen acupuncture expert.
That's
okay.
Great. Thank you so much.
Thank you. Okay, bye-bye.
Anybody have any questions? No?
Yeah, I don't know. So far, no questions.
Okay, great. That means you did a good job, Gojian.
Thank you, Josie. Yeah, so nice to see you again.
You as well. Take care.
You too. Bye-bye.
Just a reminder, everybody, certificates will be emailed out sometimes within a week, sometime within this week. Also, just to remind everybody that MPA renewal stickers aren't in yet, but once they come in, we will mail them out to members. Okay, it'll probably be sometime in December. Okay, so just be on the outlook for all that stuff.
Okay, so you guys have a good day. Have a good weekend.
Thank you, Gojian. You as well.
Okay, bye-bye.
Have a great day.
Can we just also, can you hear me?
Yeah.
Yes.
Can we also just remind members that